Hello, dental online trainers, and welcome to the Dental Online Training Sharecast. I'm your host, Dr. Dennis Hartlieb. Each month, I'll be talking with dental experts who are doing amazing work in the field of dentistry and talk about how they got to be where they are today, what their influences were, and their journey in the world of dentistry. And as a bonus, I'll occasionally throw in a few of my solo bonding sharecasts, where I share a little of my experience with you about what's going on in my practice and lessons that I've learned along the way. So tune in every other week to hear our latest episode. Hey, dental online trainers. Thanks for tuning back in to our Sharecast episode with Dr. Bill Robbins. This episode is a two-part interview, so if you missed the first part of this interview, please go check it out on YouTube or wherever you enjoy listening to your podcasts. So sit back, relax, and enjoy the rest of the conversation with Dr. Bill Robbins. Do you remember your first mentor, someone who sort of held your hand and worked you through complicated issue, someone that you could call upon? Like, this is my guy.
He was a periodontist at the Leavenworth VA. And when I first got there, he was really a cool guy. He was Hispanic. His name was Lopez. He still practices. He's probably 10 years older than me.
Oh my goodness. That's fantastic.
So if anybody listening to this knows Lopez, I'm giving a big shout out to Al. So he was a really cool guy and a very talented periodontist. And he took me under his wing and he taught me a lot about perio. And back in those days, perio was just managing disease. There was no implants, there was no connective tissue grafts, there was none of that. There were free changeable grafts, but not connective tissue. But it was all pretty much disease management. So it was all about flapping, debriding, osseous surgery. So I did a ton of that. And I got pretty good, even in my first year out of dental school in that residency program, doing traditional periodontal osseous surgery. Well, my year at Leavenworth, he left. So my very important mentor left, and he went to San Diego and started teaching in the 2-year program. So not only did I have him in that 1 year, first program, he was also my mentor in the San Diego program. And I had other great mentors there also. But I'd say Al was probably the one that had the biggest impact on me. And as you know, I still do and teach crown lengthening.
A lot.
50 years, crown lengthening is still one of the subjects I'm passionate about. I've been doing it forever. I do it well, and I teach it still as part of my teaching curriculum. And so that all goes back to those first years with that really important person in my life who was Al Lopez.
Isn't that crazy?
Yeah.
No, if you think about it, 50 years, right? How that one person just sort of sets your course in such a huge discipline and so critical for everything that you do.
So I've always been interested in the perio-restorative interface. That's always been a really important area in my life that I've enjoyed teaching about and also practicing in my practice. And so, yes, all of that stemmed from those early years with Dr. Al Lopez. Much gratitude to him.
So cool. Do you remember when you got out and you're practicing? Now you're going through the practice, and unfortunately you had to suffer through Jeff Rouse. Now, see, that's part of the problem is that when you start out in your career with Jeff Rouse in private practice, you're only, there's only so much you can make up for.
Yeah. Jeff is an amazing guy.
Yes.
And when we went into private practice, when I went in with him, it was a very rich time for us. I'm 10 years older than he is, or maybe a little more. And so I'm a decade older. And I had more wisdom in dentistry. I'd been practicing longer. I knew a lot more than he did, but he was smarter than I am.
Right.
As you know, he's one of the most intellectually talented dentists I've ever been around.
Yep.
And so for us, it was a marriage made in heaven because I brought some wisdom to the partnership and he brought intellect. And it was at that time that literally one evening we were out at a bar, we were talking, and we created the Global Diagnostic System on a cocktail napkin. And that's where it started. And at that point, we were involved with COIS. We were taking COIS courses. And, they were all about COIS. We were all about facially generated diagnosis. And we thought that was brilliant. And it all started with incisal edge position, the macular anterior teeth. But if we used it, we felt like that equally it was important to pay attention to the gingival levels, and they weren't talking about that 40 years ago.
Mm-hmm.
That was the genesis of the global diagnosis system, because our system is about evaluating the gingival levels, and the gingival levels lead you all the way through the diagnostic system. So it was those 4 or 5 years that Jeff and I worked together where we started working on using and teaching the global diagnosis system, that it's grown to what it is today. So anytime I'm talking about it, if I say I, it's not I, it's we. It's me and Jeff that developed this system together. And we still have a great friendship. We were together day before yesterday. We're going to be together for dinner on Friday night. So we don't get to see each other a lot. We don't get to teach together much anymore, but we still have great affection for each other, for sure.
So for those who aren't aware or aren't familiar, the facially generated treatment planning, Coyce and Spear, when they were together, they were teaching that and they went their own directions. And I always refer to global diagnosis as facially generated treatment planning on steroids, because and facially generated treatment planning was my introduction to complex dentistry. And I'd seen Spear present on that, and it blew my mind. And then fortunately, about a decade later, maybe a little bit longer, maybe 15 years later, I was fortunate enough to then connect with Jeff, and then I was able to connect with both of your teachings and all. But it was really just taking such a solid formation or a foundation of information that Coyce and Spear had sort of developed, and then really looking at it beyond that, like you said, the gingival levels, but even beyond that, gingival levels, but also looking at things extraorally, the lip position, the lip movement, right? And I think all that made me start to understand looking at things well beyond just the tooth. So
thanks for that. I always think it's important. I always want to say all of the credit for facially generated diagnosis goes to Coyce and Spear. They were the driving forces that created that life-changing view of the world for all of dentistry today. So they get a ton of credit for that. Global diagnosis is not meant to take the place of facially generated diagnosis. It's just additive on top of it, and I think makes it better. But the credit still goes to Coyce and Spear. They're the ones who made the paradigm shift for dentistry away from nathology, which is so complicated, nobody could do it, to facially generated diagnosis, which everybody could do.
Yep. Yeah, and again, you guys just took it to the level of actually making it, going to the higher level of aesthetics. And I think now when I look at the cases, there's so much more that I'm looking at: lip movement, lip position, lip movement, all those issues. I've just sent off a text to a plastic surgeon that I work with for some lip stuff on a patient that has just a really gummy smile and doesn't want to go through orthodontic surgery and stuff like that. So we're going to look at some alternatives. So, but that's
our world, isn't it? That's what we love to do.
It is our world, but it's without influences that help us see that stuff. Then we only know what we know, right? We only see what we know. Right. And so without question, that's been super, super influential in my learning. So I'm super grateful that I ran across your guys' path.
Well, thank you for that. That's really nice.
So Bill, tell me, so one of the things that I'm super curious about is that, so you had your associate position with Jeff. You guys were together for years. And then you've been in practice now with Brad Beckel, and Marcella's more recently with you.
Right.
So coming full circle in practice, talk about now having a private practice then where you're in a partnership, and what did that look like as you grew your practice, and then talk a little bit about that after you guys sort of got your wits about you and got your practice so it was survivable.
We practiced with Jeff, my wife. I say we because my wife was really intimately involved. She's a hygienist. She ran the office and did the hygiene. So we practiced with Jeff for 4 or 5 years. And then he left the building, the rental space that we were in, to do the process program. And so I was still in this old building, and it was ratty, and the office was beautiful, but the old building wasn't. And we knew we had to leave. So I took in a young associate that I'd met when I was teaching. She was doing a GPR at the VA in San Antonio. I took her in, and she started growing her practice inside mine. She was just an associate. I was the owner. And we decided to build a building, a little condo and a condo development. So against the good advice of our financial advisor, we decided to build it together. He wasn't a partner in the practice, but we were a partner in the building. And she was a wonderful woman. and a good dentist. She was slow, but she was really good. The patients loved her. And I know we would have been successful. But nine months after we moved into the new building, which was built for two, she herniated a disc in her neck. She had a surgery that went bad, and she's never practiced since. So all of a sudden, I've now got this building built for two. I have to buy her half of it. And I went for about 3 years with my tongue hanging out, trying to pay the bills and pay for this building. And I didn't have enough patients to bring a young dentist in. I mean, my practice is 10 or 12 new patients a month. You know, I don't see a lot of patients, didn't back then. So I couldn't bring anybody in. I needed to find a dentist that had some patients that could come in. And that was Brad Beckel, who became my partner, had worked with his father. And it wasn't working out with his father's practice. And so he came and started working with me a day a week and then 2 days a week. And he loved what was going on in our practice. And eventually he left his dad, came to my practice, worked here as an associate for a while, and then bought in. So we were partners, 50-50 partners for quite a number of years. And then 5 years ago almost, then Marcella bought in. Marcella Alvarez is a wonderful young prosthodontist that trained at LSU. Her story is I love her story. She came to my office about 10 years ago, or maybe more than that now. She was a dentist in Mexico. Her husband moved to San Antonio for a job, and I lectured in Mexico quite a bit. Her mother heard me lecture. Her mother's a dentist, and so she said, go to his office and see if you can get a job as a dental assistant. So she came to our office, and we didn't need a dental assistant. But when we interviewed her, we knew that we couldn't say no to her. I mean, she was such a jewel. So we hired her. And not long after we hired her, my chair side left, and so she became my chair side. And so we worked together a couple of years. She is my dental assistant. She then got into proth at LSU, did proth. She came back to San Antonio. She worked in the office a couple of years, 2 or 3 years, and then ultimately she bought my half of the practice. So she was my dental assistant. She was then my boss, or she was my prosthodontist, and then she became my boss. And so now for almost 5 years now, I've been working in the practice just as an associate. She and Brad are partners. And, you know, a lot of these things don't work out. A lot of practice transitions don't work out well for the old dentist. And I've lived under the sun my whole life. I've never lived under a cloud. Everything has been good for me. And this is just an extension of that because we have a wonderful office. I love the office. I love the culture. We've got a great team. I can come and go as I want. I've got no obligation anymore. If I want to go off and take a 3-week vacation trip, I go. And when I come back, I can work 2 days, 3 days. I can do what I want. So they just give me the blessing to be a part of the practice, but they don't expect a lot out of me anymore, which I'm grateful for. So I'm really living my best life right now. I don't have the obligations of running the practice, but I get to come in as be a part of a wonderful team, a wonderful practice when I want to be here.
Well, that's how it should be. That's how the transition's supposed to be.
It's supposed to be that way.
What do you think makes a good partner when you and Brad were in partnership? What makes a good partner?
Well, I think, first of all, you got to have similar core values. I mean, if your values are different, your partnership is going to go nowhere. Mm-hmm. And, you know, if your core values are such that if you get the patient brings in cash and pays you in cash, and at the end of the day, you take that cash and sort of put it in your pocket. If that's a core value for you, then your partner better have the same core value. So I think that's the number one thing in a good partnership is that your core values are the same. The problem is that you don't always know that because people don't always tell the truth in the honeymoon. Sometimes you're in a partnership where you realize the core values are not the same. It turned out that mine and Brad's are, and so that never was a problem for us.
Did you guys write it out? Did you have your core values for the practice and stuff like that?
I did have, yes, I already had a mission statement and all of that when I'd been through with my consultant. So yes, that was all written out. But once again, words are cheap. Mm-hmm. And until you really are in the fire with somebody, you don't know if their core values are real or if they've just been spouting words and they don't really have the same belief system. But once again, fortunate for me, Brad has excellent core values. He's a man of integrity. And so we never, ever had a problem with the integrity side of our practice. However, I do think the other part of a good partnership is a really well-written contract. And that means you have to have attorneys that on each side that are involved in writing contracts that care about the other person. I've worked with Kane Waters for years, and I'm a Kane Waters fan. And one of their core values is that any type of business deal has to be a win-win. If it's not a win for you and a win for the person that's buying or selling, then it's not going to be a win long term. And so Kane Waters' core values were similar to mine. And so when we got started, when Brad and I got into this together, we had very good help in creating a plan, a transition plan for him to transition into the practice as a part owner, and then so on, a half owner. And so I think it's two things. I think it's having really good similar core values, and number two, having a really good support team, putting together a contract that pretty much spells out everything. It leaves literally nothing to be assumed. That's really important.
I'm so glad you brought that up. First thought, I think some people don't know truly their core values until they're under pressure. I think a lot of times when young dentists, and not just young dentists, but any dentist, but especially when you're younger, I think you're sort of figuring that out, right? And so if you haven't been put to the test, maybe you don't really know what they are, right? And so for younger partners, I think that can be one of the challenges is that I remember as a young person, I was still trying to figure out who the heck I was. And so I think that can be a challenge for sure. But I think that's great. I think you're right on. And I think I've been lucky. I had a great partnership with my first partner, Monica Ziebert. She went off to medical school, but we worked really well together. We shared very strong core values, and I worked with Buddy Mopper, and super strong values. How we treat patients, how we treat staff. Just awesome. And then my current partner, Chris Ching, I think we have very, very similar core values. And so it makes it so much easier when there's a challenge in the practice, when it's not about the individual, it's not about a situation, it's about the core values. And is that person, maybe it's a partner, hopefully it's not, are they living up to the core values of the practice? And if you can just say, these are the values that we've aligned to, and hopefully that they are the person that they thought they were when they shared those core values with you and stuff. So I agree 100% with that.
Yep. And what you said about under fire is exactly right. I don't know. Neither of you and I have ever lived in any other skin except the skin of a dentist, but it's hard for me to imagine that there's any other profession that's really more difficult in healthcare than being a dentist.
No way.
I just don't think that there is anything more difficult than what we do. And it takes a pound of flesh sometimes to get through a week. And, if somebody that you're working with doesn't have the same level of integrity that you're assuming that they have, then it starts to come out. Because under pressure, that's when you find out if the integrity is there or not. So, yeah, it's hard. I'm not sure I've got great advice except maybe to live with somebody before you marry them. I think spend some time with the person, a significant amount of time, or you actually, either bring them in or buy it. Either way, make sure there's going to be a good marriage before you do it.
My first partner, Monica, would say she did a 2-year fellowship in geriatrics at the VA here in Chicago. And she said, Dennis, age makes you more of what you are.
Yes.
And I've always said that, and I think stress makes you more of what you are also. It sort of reveals the true individual sometimes.
Yeah, in fact, one of my old things I love is you can best measure a tree when it's down. Yeah.
Right. That's such a good line. You're right. The other thing you brought up, and I'm a big fan of Kane Waters, so it's not an ad for Kane Waters. They don't support us in any way, but I love the relationship we have with them. And when Chris came in as a partner, they said exactly what you said. This has to be a win-win situation. If the senior doctors win and the associates, the junior partners at a loss, then it's going to be a failed relationship.
The days of doing this type of deal with a handshake are gone. It doesn't matter how high the integrity is of the old dentists and the young dentists. Those days are done.
Yep.
You have to have a professional working for you. I think it's important that they work for you, not for the both of you, but for you. The other person needs a professional also. I just think You cannot afford not to do that if you're in a transition, either coming or going, either way.
Too big of a deal, and especially in these days with all the pressure with DSOs, and I think the market or the pool for associates is completely dwindled, and I think the market for young dentists who want to buy into a practice is completely dwindled, as so many people have just sold to DSOs and all, which is all fine. But I think the markets have changed, and I think we just have to be even more secure in these relationships, both, through our core values, emotionally, intellectually, but also legally. We just need to make sure that we're doing the right things.
Yeah, especially if you're doing relationship-based dentistry.
Yes.
That's different than commodity dentistry. And it's not so hard to find a young dentist that, come in and work for $600, $700 a day or whatever it is. And I mean, they're around. But if you're wanting to build a lifetime relationship with somebody, and somebody that's got an entrepreneurial spirit that wants to be an owner at some point, that's something you have to figure out early on. If you're looking for somebody to share your practice with and eventually buy it, there's a lot of young dentists now that don't want to own a practice. And I get it. I don't necessarily blame them. I don't think it's a bad decision necessarily, but you don't want to get one of those people in. They are really bad dog about being an owner if that's a goal for you down the road. So that's why all this preliminary discussion is so important before you bring somebody into your office.
Two questions. So you talked about commodity-based dentistry versus, I think you called it relationship-based dentistry. Talk a little bit about that. Talk about how, sort of where that came into your world. So commodity-based versus relationship-based dentistry.
Yeah, I guess it was just a natural progression for me, because when I was in academics and institutional dentistry, we did everything ideally. That was one thing we always did. I mean, every resident always did a comprehensive exam. I mean, every patient got a full mouth set of x-rays. Everybody got period probing. So that was core value for me. Doing a comprehensive exam was a core value for me. And when I went into full-time private practice, I made two decisions. One decision is that I was going to do a comprehensive exam on every new patient. And that was a difficult decision to make because, as you know, probably at least 50% of the new patients that come in don't really need that. I mean, they're healthy, they need a sealant and bleach, and that's all they want. And my wife used to get on me so much for wasting all this time on comprehensive exams on patients that didn't really need, a lot of dentistry. But I kept saying, that's my core value, that's what I'm going to do, and it's going to pay off dividends because patients say, I've never had an exam like that before, and they send other patients. And so for me, the transition from academics was easy from a point of view of making a decision about comprehensive dentistry, because that's what I was going to do. And the other was I dealt with insurance enough through the faculty practice to know that it wasn't going to be appropriate for me to be a PPO provider. And in fact, it really made no sense at me at all to take assignment of benefit. And so I made the second decision that I would not be a provider for any insurance company, number one. And number two, I wouldn't take assignment of benefits. And if you start off that way, then that's patients expect. I mean, there's nothing to explain. This is how we do it. You'll pay us, and you will pay half the day we prep the crown. You'll pay the other half the day we insert it. We'll submit it to the insurance electronically for you, but the check will be sent to you, and you'll pay a complete fee to us, and you'll be reimbursed whatever the insurance company will pay. And to me, it just doesn't make sense to do it any other way. It never did. It still doesn't make any sense to me today. And yet 95% of dentists pay assignment of benefits. And then they're out there chasing another $15 off of a pro fee that the insurance didn't pay. I don't know. And I just have lived a blessed life, and I started my practice out that way. And therefore, I never had to make a change along the way.
God, I love you, man. You're preaching to the choir. I tell you, I agree. I've always done a comprehensive exam. I didn't know. I was so naive. I didn't know any different. I thought you just had to. Yeah. And so we always, it's just like, well, you have to do a comprehensive exam. You have to do that before you go into hygiene. That's what I learned at dental school. So yeah. I was so naive. I thought that's what you were supposed to do. And so that's what I did. And secondly, I remember first patient I treated in private practice, Mrs. Schad. We did assignment of benefits because that's how the practice that my partner Monica and I took over. And I did a restoration, and her bill was $32.87. You know why I know that? Because she sent back a letter when she refused to pay after we sent her letter after letter was, I have more important bills to pay. I had to take my cat to the vet.
Yeah, there you go.
For over $32.87.
Yeah, I know. Well,
So
there's no judgment in this. I know most dentists need to have at least some PPO involvement in the practice. I totally get that. I honor that. I still think you can do great dentistry and be a part of a PPO. I think you can. I just think it's more difficult to do it.
I agree.
Because you can't do comprehensive exams on all your new patients if you see 20 new patients a month. It's not possible to do that. But you can still do hygiene, bring patients in through hygiene. And those that require comprehensive exams, you say, Mrs. Jones, it's so nice to meet you. I really appreciate you coming to become a part of our family. I can't give you what you need in this hygiene exam, so I need to get you back and do a more comprehensive exam. As long as you get those back in that need the exam, you can still do beautiful dentistry without doing comprehensive exams on everybody. But I will say that you can't do comprehensive dentistry if you don't do comprehensive exam. So if you don't do a comprehensive exam, you can't do anything more than single tooth dentistry. That's period, done. So for those that when we teach and all you and I are teaching, the things that we teach, which are interdisciplinary dentistry, you can't do interdisciplinary dentistry if you don't do a comprehensive exam and you don't have a good camera and have the ability to take good photographs. Those are two essential steps in doing interdisciplinary dentistry.
And the ability to communicate. And I think that's, without question, that I think is the biggest resource or the greatest resource for the dentist in the next millennium, is just the ability to communicate with all the tools we have to communicate. It really comes down to the provider being able to help the patient understand what their problems are in such a way as they don't scare off the patient.
And the thing that's so interesting about it is we spend now 4 years learning to become a dentist, to get rudimentary skills, and people aren't willing to spend an evening a week for a month to learn leadership or to learn communication. I mean, the skills are equally important to a successful dentist, if not more so. And yet you spend all these years on the professional side and spend literally no time, read no books, do no continuing education on leadership and communication. So it's definitely a pet peeve of mine in talking to young dentists. You have to give the same energy to these two things, communication and leadership, that you gave all those years to learning your clinical skills.
Great advice. You also gave great stuff on being a partner. I want to finish up what's a great associate, not in your stage, but a dentist who wants to come in and be part of the practice. What's a great associate look like?
And a great associate to me, well, let me back up a minute and tell you about my son. So my son was in pre-dental when he went to UT Austin. When he graduated, he said, Dad, I'm sick of school. I'm not going to dental school. I'm done. I said, excellent. Go find your bliss. So he moved to Dallas. He worked for about 3 years for people that weren't very smart, and he didn't make much money. And he realized, I got to do something. He circled back to dentistry. So we went to dental school. He graduated last May. He's now doing the 1-year AGD program at the VA here in San Antonio. His program director was one of my residents 30 years ago. So the circle continues. But the reason I circle back to him is because I never really expected that we would have an opportunity to work together. Me and my dad never had an opportunity to work together. And since I sold my practice 5 years ago, I assumed that he and I would never work together. And he always said he was going to probably go to Austin to practice because people love Austin. It's a cool city. Mm-hmm. But in the last 6 or 8 months, it's all changed for him now. They started doing his residency program. And he doesn't want to go to Austin. He wants to stay in San Antonio, and he wants to work in our practice. And so obviously I'm excited about that, although it's not my practice anymore. Right. He's going to have to deal with Marcella and Brad, but he's very likely going to be an associate in this practice. And we've had another associate in our practice that ultimately left. And sort of the difference between the one that left and the one that stayed, which is Marcella, I think was her commitment to be a mentee, if you will. And that means still today, Marcella and I sit back to back in our office. So our chairs are literally a foot apart. And several times a day, she will bump the back of my chair. And that's kind of, if I'm happening sitting there, that's a sign she wants to talk about something. And we swing around knee to knee, and we talk about everything from family to dentistry to lecturing to teaching, whatever it is. But she has been over my shoulder now for 6 or 7 years, really paying attention to what, and Brad's also, by the way, paying attention and saying, this is what here's an x-ray of what I did. I'm not really happy about this. What do you think happened here? In other words, she has been a great student in our practice. So I think what makes a really great associate is one that wants to continue being a student. And assuming that the old dentist in the practice wants to really be a mentor, that's a marriage made in heaven. So for us, that's what I think made Marcella such an amazing associate before she became an owner, was her commitment to learning what there was to be taught in this office.
When I started with Buddy, I'd been practicing for 9 years, and then I joined Mopper part-time, and then came in full-time, was an associate, then bought in. But even when I was partners with Buddy, if I didn't have a patient and he was working on somebody, I would kick the assistant out of the chair and I say, I want to assist Dr. Mopper. I want to see what he's been doing lately.
Absolutely. Exactly.
I had, what a blessing it was to be able to cheer aside. I went in, before I was even associate, I went in one day a week for 3 months just to assist him, just so I could see what he was doing and get a better understanding. It was an incredible blessing. That resonates so strongly with me.
I'm sure there's other things that make a great associate. Once again, their core values have to be the same. And if you want them to be in an ownership position, they have to have an entrepreneurial spirit. But for me, I think early on, it's about really wanting to be a mentee in the office and learn from everybody, including the ladies that run the front, the ladies that run the back. I mean, you got to learn from everybody in a practice like this. And Marcella was just the best at doing that. And I don't know, my son Andrew, we'll see. The way he talks, he really said he wants to continue his residency program next year here. And so that's the right attitude. You know, that's the words are correct. Well, I think he will. I think he'll come in with the same attitude.
Yeah, I at least in a practice, I think similar to yours, like ours, where it's not a commodity-based practice. I think you have to consider that associate position as a residency program, right? Just continue learning. You have to learn the systems. You have to learn the techniques for sure. But you also have to learn the systems, right? And that can be from everything from the admin team stuff, but also how you run a consultation, right? I'm sure your consultations, Bill, are not hodgepodge all over the place. I'm sure they're very directed in how you're doing it. You've figured out a way to be able to direct the patient through the treatment that they need, right? And that's
all of that is, I mean, that's why it's so hard being a dentist.
Yeah.
You got to have skills on the shelf. That's a given. You've got to be able to do that. But then all the soft skills that you aren't taught, you got to learn them somewhere. You got to learn soft skills.
Yeah. So all those young dentists out there, dental students who are listening, I think, and I agree with you, I think this is the key, is find someone who's willing to mentor when you get into a practice. And I think that would be a conversation I would have. And it was obvious with Buddy, he was willing to mentor me throughout and teach me everything he knew. That's what he said. I'll teach you everything I know. And so I think you need to get in that relationship if you're in this type of practice. If you're in a commodity-based practice and you're just about cranking out the numbers, and that's a different story, and that's okay. But there's a lot to be learned in that type of practice also. And so I think you have to grab onto that and understand there's a lot to learn, even for someone like me that was practicing for nearly a decade before I joined Buddy in his practice. All right, before we go, I want you to share with everyone what you're doing with Jamaat and with Global Diagnostic Study Club. So talk a little bit about that before we let you.
Yeah, thanks for the opportunity. So during the COVID crisis, a friend named Kirk Barrett, I'm sure you know Kirk.
I know Kirk well, yeah.
Owns a consulting business called ACT Dental, ACT Dental. And I've been good friends with Kirk for many years. And when the March 15th shutdown, 2020 happened, right about that time, he called me up and he said, I'm really scared for our profession. And he's not a dentist, but he considers dentistry to be his life just like we do. He said, I'm really scared for our profession, and I think we need to do something to help get us all through this. I said, what are you thinking? He said, I think we need to create a COVID relief conference, is what he called it. I said, I'm all in. So over the next 2 or 3 days, we made telephone calls to friends, and we started meeting 5 hours a day for 10 weeks. And we got great speakers from all over the world to give free lectures. Sometimes we would have 2,000, 2,500 people on the Zoom meeting. That's where we all learned to do Zoom. And that went on for 10 weeks. And I was really involved in that a lot. I was the host to many of the speakers, and I asked questions. I also gave quite a number of lectures myself during that 10 weeks. And so that gave me a faith that many people didn't know. I didn't have, that reputation where all the United States knew me like Poison Spirit or Mopper. I wasn't well known like that, but this gave me a faith. And at the end, I thought, man, this is a wonderful opportunity. And Jim Otten, Jim is a wonderful restorative dentist in Lawrence, Kansas, that is a little younger than me, but not much. And we had talked about doing a consulting business together as our practice has slowed down, but we could never get it off the ground. So I called up Jim and I said, Jim, I think this is it. This is our time. Let's create an online study club. And he goes, let's do it. So in June, first week of June in 2020, we started Global Diagnostic Education. That's the name of our online study club. So we've been going now almost 4 years, and it's turned out to be a wonderful thing for Jim and I. And we didn't realize really when we got started how great the synergy was going to be between us, because we have similar practices. He has a fee-for-service, high-end practice like mine, low volume, high quality kind of practice. But his practice was much more oriented towards treating patients that have joint problems. So he drew those types of patients to his practice. So he became a world-class expert at managing patients that have TMD and joint issues and all of that. So my practice wasn't geared that way. I was much more into the perio-restorative kind of practice. His was restorative, but also joint-based restorative. And so I didn't have the skills that he did in the areas of the joint, and I had more experience in the perio-pros part of it. And so when we came together, it turned out to be like a full package. And so we did a lot of foundational lectures early on, and now we sort of moved to the point where we have 4 legs. We meet twice a month. We meet at 8 to 10 o'clock Wednesday nights, sometimes Friday morning, commonly Wednesday nights, Central Time. So it's about an hour and 45 minutes to 2 hours twice a month. And we have one of 4 things. The first is Jim or I will continue to give foundational lectures probably forever, but we give fewer than we used to. Him more on joint-based occlusion, me more on interdisciplinary treatment planning. The second leg of the stool is experts coming in, friends, and getting lectures like you're going to do in about a month and a half for us. Thank you for saying yes to that.
You're welcome.
The third leg of our teaching stool is treatment planning. So we teach a treatment planning system. And so we've got a template that all of our members have access to. They download their photos and information in, and they present treatment plans on our evening programs. That's the third stool. And then the fourth is we've got a handful of members who are very talented and teachers also, and we call them our mentors, and they give programs. So we have speakers from the outside like you. We have treatment planning. We have mentors in our study club that do programs of treatment planning, and then sometimes Jim and I give lectures. So it's a subscription to join. We've now got a great library of well over 100 videos that are in different compartments. So if you're interested in joint-based occlusion, there'll be a list of about a dozen joint-based occlusion. If you're interested in composite, there will be a whole group of composite. So it's whatever the subject is you're interested in, they're in the library now. So members that become a member of this, they have access to the twice a month meetings and also access to the video library. And then once a year, we have a symposium. This year, the first week in September, we meet at Kurt's Place in Milwaukee. Our symposium keynote this year is going to be Kyle Stanley. And I assume many people listening to this know who Kyle Stanley is. He's one of the most influential young dentists in the United States today. And he's got 2 primary programs that he talks about. One is AI. He's a part owner of a company called Pearl AI. And the second is mental health. He's become a real advocate for mental health and dentistry. And so he will be sharing both of those areas at our symposium. So in a nutshell, that's what we do. Our website is globaldiagnosticeducation.org. And if anybody's interested in learning about it, go there. If you want to contact me individually, I'll give you my email. It's old-fashioned and easy to remember. It's Robbins, 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 DDS at AOL.com. So you can send me an email and I can talk to you about it on the phone, or we can discuss it over email, either way. So if anybody feels like that they're looking for some mentorship in the areas of interdisciplinary treatment planning, then Global Diagnostic Education has been a fun endeavor for Jim and I. And the cool part is that I don't know if you know, Gary DeWood recently left Spear, and Gary DeWood is now the third mentor in Global Diagnostic Education. So that's now fantastic. It's not just being Jim Ott, it's also Gary DeWood. So
it's awesome.
The team just got like twice as strong by adding a third member.
That's awesome. Funny enough, so we're having our DOT Fest in June, and we are also having it at ACT headquarters.
It's a great place, isn't it?
It's fantastic. In the heart of Milwaukee, so just a few miles from where I live, and with Kirk Barron, who is just an incredible person. If you haven't checked out Kirk's podcast, it is under ACT Dental. What's he call his podcast?
Well, Best Practices, I think.
Yeah, the Best Practices show. And he's got a great podcast. So if you haven't checked that out, you should check that out.
He does indeed. Yeah, he's a great guy for sure. And Milwaukee's a wonderful city too. God, we just had such a good time there.
Milwaukee's a wonderful city. So for anyone interested in following up with Bill, what's the email address again?
So my email address is robbinsdds@aol.com, and the website is globaldiagnosticeducation.org.
Perfect. You're going to learn a lot from this guy. I cannot tell you how grateful I am for you spending the time with us. I didn't mean to keep you so long, but I had so much I had to ask you, and I just had to get it in.
Well, it's been a big pleasure. Again, thanks, Dennis, for including me. It makes me feel special to be a part of this podcast. And also, thank you for agreeing to be one of the experts at our Global Diagnostic Education meeting coming up in a couple of months. You're going to be talking about, as I remember, the replacement of the missing maxillary lateral incisors.
Canine substitution cases. Yeah. So I think that's very interesting, especially when they show up to your door and the canine's already been substituted, and how do you manage it? So,
great subject. We can't wait to hear it.
Well, thanks again, Bill. I look forward to seeing you in less than a month. We'll be at the Restorative Academy, and I look forward to seeing you there.
We'll share a glass of wine and a hug.
Absolutely. All right, dental online trainers, thank you so much for hanging out and listening to us sort of chit-chat about Bill Robbins' background and his sort of walk through dentistry. It's there's a lot of layers, man. This is an onion pulling off layer after layer, and it's kind of the blooming onion. And so I cannot thank you enough. And for our dental online trainers, thanks for joining us. As always, yours for better dentistry. I'm Dr. Dennis Hartlieb. Well, thanks so much for listening or viewing our Sharecast today. If you enjoy this and you want to get more information from dental online training, then check us out at dothandson.com. That's one word, dothandson.com. And hey, be sure to share this with your friends and colleagues, anyone who you think might benefit from this Sharecast. And please be sure to leave us a 5-star review if you enjoyed our conversation. This podcast is edited by Luna Clark and includes original music by Chris Peterson. And again, thank you for listening. Yours for better dentistry. I'm Dr. Dennis Hartlieb.